Epilepsy. Anyone can be diagnosed at any time of their lives, young or old, male or female. And if you or someone you know is told they have epilepsy, here's some of what you should know.
You're one of the hardest working advocates, honestly, for epilepsy that we have.
I appreciate it. It's close to my heart, and I know how much epilepsy affects children, adults, families, and there's just a lot more we need to do as a medical community and a lay community.
And there's every aspect of epilepsy and new therapies. There's so much that I could pick your brain about, but I want to talk about SUDEP for a second, because we all in the community, and as a parent of a child, so as a grown man who has epilepsy, this is something that's in the back of, I think, most of our minds if we have even heard about it. But first, just tell people, what is SUDEP?
SUDEP is sudden, unexpected death in epilepsy. And it unfortunately is a very common disorder. It's one of those things that if you look at it for a single patient in a short period of time, it's not so likely. But when you look at a young person whose seizures continue, especially if they have some breakthrough tonic-clonic seizures or grand mal seizures, over the course of a decade, the risk could be from 1 to up to 5%.
Wow. And you still look at that and say, okay, well, that's still a very small percentage, but it really isn't when you think about it. And
when you look at it over time, it's different. And I should just say, to clarify what it is, it's when someone with epilepsy dies and there really is no other cause.
Now, is there anything that we have discovered so far outside of, being strict with your regimen, getting sleep, taking a nap, taking your medication on a regular basis? Is there anything else that we can do, patients can do, or caregivers can do to prevent or help prevent?
Any way to get better seizure control, which could be referral for epilepsy surgery, consideration of a stimulation device, a new drug. But in addition to those basic things, the other thing that has emerged from several studies, it's not absolutely proven, but we think it's probably true, is that some type of monitoring, if someone else is in the home or the apartment. So if you have a 30-year-old brother who lives in your apartment with you and he has occasional nocturnal seizures, then just even having a sound alarm, a baby monitor, literally may allow you to know that a seizure's occurred. And what we found from epilepsy monitoring unit studies and also from studies in England where people who have developmental disabilities live in a residential setting. Mm-hmm. And in those settings, they're closely monitored. Counselors go by, there are listening devices. The rate of SUDEP is extremely low. The SUDEP occurs when the person goes home and is with their adult parents sleeping in a bedroom down the hall and then has a seizure at night. Nobody knows about it, no one attends to the person. So in many cases, if there's a nocturnal seizure, probably simply stimulating the person, rolling them on the side, saying, "Greg, are you okay?" Mm-hmm. Very gently, just arouses them. And that arousal after a seizure may help instigate breathing again and prevent the cascade that leads to SUDEP.
That is huge, what you just said. That's not something I knew about, honestly. If there's even the smallest chance of stopping the percentage of it happening.
Exactly.
Because it can happen to anyone. Because you may know someone right now who has epilepsy. Please learn more about it and promise to talk about it. I'm John Mayer, reminding you to talk about it.